David Cameron, the British Prime Minister, said the monetic pool of UK benefits had to be addressed so people came for the right reasons and the rules put Britain first. The Prime Minister also had a warning for those who are in the UK illegally, saying that they would be found and sent home. However, Labour is convinced that the Prime Minister's rhetoric masks a record of failure on immigration, and now firm action is needed.
It's an immigration system that puts Britain first, and so what we're doing today is a whole series of changes that says to people, if you come here illegally, we will make it harder for you to have a home, to get a car, to have a job, to get a bank account, and when we find you, and we will find you, we'll make sure you're sent back to the country you came from. And we're also doing more today to close down bogus student colleges. We've already closed down many of them, and we will close down more. It's really right that the British people know that we have a fair immigration system that says to people, if you're here illegally, you should go home.
When we come back after the break on The World Today, first, Consultants Medical Center, the hospital where the only case of Ebola virus in Nigeria was being treated in the country, tells us more about its victim who has since died. Please join us again. Welcome back to The World Today. Our focus now is on the Ebola virus here in Nigeria. Now, for the first time since a man died of the virus in Lagos, First Consultants Medical Center, that's the hospital where Mr. Patrick Sawyer, the victim identified as having Ebola, has been speaking about it all and what it did to ensure that the spread of the disease was curtailed and the infection rate eliminated. The hospital admitted Mr. Sawyer with symptoms suggestive of malaria. The symptoms were fever, headache, and extreme weakness. The hospital says even as the victim was confirmed positive for malaria, it came out negative for hepatitis B and C and HIV. It started to conduct further tests since Mr. Sawyer was not responding to treatment and was developing hemorrhagic symptoms. A statement adds that although Mr. Sawyer denied being in contact with any person with Ebola, it decided to test him for the virus, bearing in mind that the victim was coming in from Liberia, where there's been an outbreak of the disease. Our First Consultant Medical Clinic did say that it quarantined the patient and then began barrier nursing and simultaneously contacting the Lagos State Ministry of Health and the Federal Ministry of Health for additional laboratory tests based on its suspicions. Then it says it resisted immense pressure to discharge Mr. Sawyer from its hospital, despite insistence that he had a meeting to attend in Calabar, which was the ECOWAS convention. Now, according to the hospital, the initial results from Luth Laboratory indicate a signal of possible Ebola virus, but required more confirmation. So, First Consultant said it went further to contact senior officials in the Office of the United States Secretary of Health, which then assisted with contacts of the Center for Disease Control and the WHO Regional Laboratory Center in Senegal. Now, the hospital adds that working with state, federal, and international agencies, it was able to confirm that Mr. Sawyer indeed had the Ebola virus disease. He died, unfortunately, at 6:50 a.m. on July 25th, according to the agency. All agencies, beg your pardon, were informed of his death. The hospital was then shut down temporarily with immediate evacuation of in-house patients while it removed and incinerated Mr. Sawyer's body under WHO guidelines, witnessed by all appropriate agencies. A part of a statement that they released to us says, in keeping with WHO guidelines, this hospital is shut down briefly as full decontamination exercise is currently in progress. The reopening of the hospital will also be in accordance with WHO guidelines. Now, the Ebola virus is certainly putting authorities in Liberia on their toes. In order to contain the rate which the virus spreads, Liberia has suspended all football activities. A football association said there was a risk of infection because football is a contact sport. And sadly, the World Health Organization has confirmed that the number of people killed by the virus in West Africa has now reached 672. Ebola kills up to 90% of those infected, but patients have a better chance of survival if they receive early treatment. It's spread through contact with an infected person's bodily fluids, and this is the deadliest outbreak of the disease since it was reported back in the 70s. It spread to Liberia and also Sierra Leone, with just one case now in Nigeria, one case reported previously also in Ghana. I have with me now our health correspondent here on Channels Television, Yomi Otaibe, to talk more about Ebola. So people are really scared, of course, here in Lagos, understandably so. One person, and then the fear is, how many people was he in contact with?
Okay, it's nice to be here, first of all. And yesterday there was a briefing by the Joint Health Sector, the Lagos State Ministry of Health, the Federal Ministry of Health, and other international partners. And indeed, 59 people have been identified and registered. Of course, this includes the nurses that attended to him at the airport, 3 ECOWAS members of staff, the driver, the liaison officer, the protocol officer, and a few other people. Now, what we need to clarify is that yesterday the briefing, it said Nigeria's ambassador to Liberia, Ambassador Chijioke Obi Nnadozie, yes, that she was on that flight, but indeed it has been clarified now by the Federal Ministry of Health that she was not on that flight. Indeed, it was the ECOWAS president, representative of the ECOWAS president in Liberia, Ambassador Babatunde Ajishomo, that was on that flight.
So what you're indirectly saying is all those on the flight with Mrs. Sawyer, all the way from Liberia, have been quarantined?
And those that were on ground.
Those were on ground.
Those in the hospitals, they've been, identified, registered, and they are being monitored now to see, okay, between 2 and 21 days to see if they're going to come down with any symptom. But it's very important to point out that the Federal Ministry of Health, the Lagos State Ministry of Health, and every other partner involved in this need to bring out every information that is coordinated. Because now I hear that Ambassador Nnadozie, she's already been queried in Liberia, and the government wants to take her in and all of that. So this misinformation should actually be checked.
But would it be wise to take in people who are suspected of being, in the line of fire, probably those who might have had contact with the man himself? Because what I heard was that Mr. Sawyer was at the Nigerian embassy in Liberia. Okay,
well, on the Liberian part, we'll have to wait to see what they are going to do. But right here in Nigeria, the contacts, according to the director of Nigerian Center for Disease Control, Professor Abdulsalami Nasidi, will come in 4 types. First, the people that had casual contact with him. Secondly, those in the hospital that had contact with his blood and other bodily fluids. And then, like those that work in the mortuary that had contact with the dead body.
Yeah.
And more importantly, those that had contact with all of this group of people that have had contact with the late Mr. Patrick Sawyer.
So the list just gets longer. But okay, for the benefit of our viewers, a lot of people are wondering, okay, so now that, is it safe?
There's been a lot of panic everywhere.
Exactly. Is it safe to say there's no Ebola in Nigeria?
As at now, and from what the joint team said, there's no case reported aside from Mr. Sawyer's case.
Okay, so let's just talk about preventive measures very quickly before you go, because people are afraid of shaking hands now. People are afraid to hug people on the